Hi everyone, my name is Dr. Leah Walker, and today we are going to be bonding the AP2. And we're going to show you how we do this in our office. So the first thing you want to do is obviously get the teeth nice and clean. We just use a regular old pumice, and then we etch everything. In this case, we're bonding the AP2 from the canine and the molar, and then we're bonding the Kaplan hooks onto the lower sixes. His lower sevens aren't erupted enough, but if they were, we would bond to the lower sevens. So my technique is just to use etch with a self-etching primer, and then I use Transbond, but you can use whatever glue you normally use to bond your brackets. So here you see the direct measuring tool using the measuring template to see the sizing. In this case, I think we kind of measured the right side as a 29, the left side was a 28. I also use a CBCT to do this measurement as well. But for instructional purposes, we were just showing you how to do it intraorally. So you want to put a significant amount of glue on the pads. And again, she's already etched. Now we're going to use the self-etching primer. And then we're going to bond. Now, because we use a good amount of glue, we do have to remove a little bit of glue that has come out just to keep everything nice and clean. Now, I do tend to bond my AP2s a little bit occlusally on the upper canines, just because during the course of treatment, as the patient wears the elastics, we're going to get some extrusion of those upper canines, which is going to tip our occlusal plane in the right direction, but I don't want excessive extrusion. So here we go to the right side. Now, the nice thing about the AP2 is it doesn't take long to actually put it on. So when we have patients that come in for an exam and they want to get started right today, it's really easy to do so. And it doesn't take that much time off the schedule. Now, I always check the occlusal portion before I bond, just to make sure that the pads are adapted really well to the teeth. So after we have light cured everything, then we want to go ahead and remove those elastomeric ties. You don't want to leave those on, just in case you do get an accidental debond. The patient could easily remove the front buccal arm off the molar pad, and it's not dangling there. So no emergencies. So from here, what we want to do is we want to create our lower tray. So we'll show you how we just easily scan the teeth and then create a tray. And you can use an 030 or an 040. I used to use an 040. I'm kind of tending to use more of the 030 lately, just because most of the time the teeth on the bottom are pretty crowded. And so sometimes those 040s are a little bit difficult to get on. So this is my assistant actually trimming out the space for the Kaplan hooks. And you just want to make sure you don't trim too much with this, because if you trim too much around the molar, there's more of a opportunity for the molar to rotate within the tray. So the less you trim around those molar attachments, the more stable that will be. And here she is showing you how to put the rubber bands on, which I'm sure you know how. But this is a pretty simple and easy appliance for the patients to get used to. And there you go. That's the AP2.